Social anxiety disorder is a mental disorder that falls under the category of anxiety disorders. And there are many types of anxiety disorders. For example, we have selective mutism, we have generalized anxiety disorder, panic disorders, specific phobias such as agoraphobia, separation anxiety disorder, anxiety as a result of prescribed medication, using prescribed medication by a doctor to treat a different illness as a result of using drugs and other substances, also as a result of a medical condition such as hyperthyroidism. So there are many types of anxiety disorders. And the reason I'm starting here is because with anxiety disorders, they tend to have very closely related features or closely associated symptoms that can make it quite tricky to tell them apart. And sometimes they can actually happen together. You can have two anxiety disorders at the same time. So careful evaluation, thorough assessment is very critical in getting the right diagnosis for the type of anxiety that a person is suffering from. And once you have the right diagnosis, the accurate diagnosis, then you're likely to get the effective treatment. You're likely to get the right solution for that diagnosis. For example, the reason I'm insisting on this, agoraphobia is under specific phobias, yeah? Compare it with social anxiety disorder. A person can have one and not the other, or they can have both. So let's say two people, one person has agoraphobia, the other one has social anxiety disorder. Both of them are saying that they don't like social situations. But when you go on to assess, you realize that the one with agoraphobia, they don't like the spaces in which social situations happen. The other one doesn't like the people in the social situation, or rather they're afraid of the people in the social situation. So one is afraid of the space. They're afraid that they won't have easy access to an exit when they want to escape, when they need to escape. That's agoraphobia. For social anxiety, they're afraid that people are going to judge them negatively for their behavior in the social interactions or in the social context. And behaviors here, it's a wide range. You might be afraid that you're going to be judged for how you speak, for what you say, for how you dress, for how you walk, how you eat. So there are people who don't go to restaurants because they're afraid that people are watching them when they're eating at restaurants. There are people who will never go to a bathroom, a public toilet, because people are there. Even though they're able to close the door behind them, they will never pee in public toilets. And so the behavior in social anxiety disorder is what is explored, and different people will present with different behaviors as the problematic symptom of the social anxiety disorder. And this has to be there for about 6 months, and it has to impair function. So it has to impair either professional function or personal function. So for example, if a person says that occasionally I have to make presentations once or twice a year, and it does not lead to any consequences how I perform, you cannot make a diagnosis of social anxiety, even though they may experience behavioral disturbances as a result of their social anxiety, which is perhaps trembling or sweating or blushing, or they might have their heart rate, in beating fast. They might have their heart beating fast. They might have, some shortness of breath. You cannot make a diagnosis of social anxiety disorder in that case because it does not impair function. But if my role at work is to make presentations regularly or frequently, and that is appraised, that is what is actually used to determine whether I am qualified for a promotion or not. And as a result of my social anxiety, as a result of these behavioral disturbances that make it difficult for me to make a good presentation, maybe because I'm trembling, maybe because I go mute, then that would be an ideal situation to make a diagnosis of anxiety disorder, because it's impairing my professional ability to perform my roles, to be productive, to be effective. And so it's very, very important to take time to assess a person. So for social anxiety, the exaggerated fear or the intense fear is directed towards the judgment that other people are going to have on the behavior as you're interacting with them. And so most people would avoid such interactions. They would avoid meeting people, especially depending on the behavior. Yeah, so there are those who would not avoid meeting people. They would avoid situations where they have to participate in the conversation, so they would be quiet. And if they have to, then they would do it with a lot of difficulty. There would be a lot of tension within them, a lot of distress within them. So the behavior in the social anxiety is what we try to understand for us to be able to get to a point where we see if you meet all the criteria for the diagnosis. And the fear is usually quite out of proportion with the threat. So if you're afraid of being humiliated, you think that, for example, the humiliation probability is, let's say, 10%. Normal people would see it that way, would judge it that way. A person with anxiety would see the possibility or the probability of that humiliation at 80%. And so that is what would make them now have all these behavioral disturbances as a result of magnifying what the situation could be. So if you think that you have social anxiety, I would recommend first that you start picking out what behavior do you think is being negatively judged by people. So before you go to them, do you think they're going to judge how you speak? Do you think they're judging how you walk? Do you think they're judging how you perhaps present a presentation, or just your walking? What is the behavior that is making you have this intense fear of meeting people? And that is, again, because they are going to judge you or to scrutinize you or to criticize you very critically. I hope that works. I think I'll make another video to try and break down different anxiety disorders.